Unfasten all buckles and strap from the brace. Align the hinge center over the lateral epicondyle. The blue drop lock button must be positioned below the hinge. Adjust the cuff position for the forearm. Push down the length adjustment button to unlock and slide the telescoping paddle until the desired length is achieved. Avoid impinging on the styloid process. Extend the humeral cuff up the arm as far as possible without impinging on the axilla. The inner cuffs can be adjusted if needed. Try to ensure they are as close to the hinge as possible. The brace struts may be bent to achieve a better fit. Place the brace on a tabletop with one strut protruding off the edge as shown. Apply downward pressure to bend the strut. Mold the cuffs to optimize the fit around the arm. While supporting the injured arm, fasten buckle 1 below the hinge and tighten the strap. Then fasten and tighten strap 2 above the hinge. Next, fasten strap number 3 closest to the hand. Use the alligator clip to get an appropriately snug fit. Fold the strap to the correct length. Secure and tighten strap 4 at the top of the brace. Trim the straps to the appropriate length and reposition the strap pads if needed. Pull the white button out and slide it to the prescribed position and then release to limit the amount of flexion. Pull the black button out and slide it to the prescribed position to limit the amount of extension. To lock the brace, slide the drop lock toward the center of the hinge after positioning the arm at the correct angle. Check the final fit before applying the arm sling. Position the shoulder strap over the patient and attach the front clasp with the loop on the paddle closest to the wrist. Bring the shoulder strap across the back under the injured arm and then attach the clasp to the D-ring. Adjust the length of the strap until the forearm is held at the proper elevation and comfortable. Trim the strap to the appropriate length if needed and reposition the strap pad for comfort.